Vital signs for adults can be remembered by the guy reacting to having his temperature taken rectally. Normal temperature, shown by the thermometer, ranges from 96.8 to 100.4 degrees Fahrenheit and 36 to 38 degrees Celsius. When taking temperature rectally, remember to add 1 degree, shown by adding the 1 wand to the rectum rectangle, while with axillary temperatures, remove 1 degree, removing the 1 wand from the axe armpit. Normal respirations range from 12 to 20 breaths per minute, while oxygen saturation, shown by the percent O2 tank, should range between 94 and 100%. Pulse, depicted by the heart timer, is typically between 60 and 100 beats per minute, while blood pressure, the BP cuff, has a normal value of 120 systolic over 80 diastolic. Pain, the pain bolts, is often referred to as the fifth vital sign and should be assessed along with the other vital signs, and interventions should be implemented accordingly. So to recap, normal vital signs in adults include a temperature between 96.8 and 100 degrees Fahrenheit. Add 1 degree for rectal, remove 1 degree for axillary. Respirations are between 12 and 20 breaths per minute. O2 sats between 94 and 100%. Pulse between 60 and 100 beats per minute, and blood pressure of 120 over 80. Don't forget to assess for pain as well.
Vital signs for adults can be remembered by the adult who doesn't really want his vitals taken, and understandably so. That's because the thermometer tricked him when it took his temperature. It removed a 1 wand thermometer from his axe armpit and said they were all done here. But before he knew it, a 1 wand thermometer was being added to his rectum rectangle. He screamed out loud, and his respirations filled the room. And when he reached for an O2 tank for help, it just pinched a pulse oximeter onto his fingertip to find the percent of O2 in his blood. His heart timer started beating faster and faster, right out of his chest. And it pushed his blood pressure higher and higher, pumping his blood pressure cuff to see just how high it could go. Still, you have to wonder if this was all just part of the thermometer's strategy, because the man hardly noticed most of his vitals being taken. You could say he was distracted by the inherent pain bolts of adding a 1 wand to one's rectum.